Welcome to the CoolTouch CTEV treatment environment. This program will give you a brief overview of the features and setup of the CoolTouch CTEV laser system. We will explore the equipment, personnel, and treatment techniques used in treating chronic venous insufficiency and varicose veins. The patient arrives and is escorted to the outpatient treatment room. Vital signs are taken, and the patient is gowned to expose the leg for photos and prep. The CTEV procedure is generally done in the physician's office with 1 to 3 staff assisting. Primary staff responsibilities during the procedure include managing the ultrasound support, managing the laser and pullback device, and managing the sterile instruments and patient. With the patient on the procedure table, ultrasound is used to mark and map the location of the vein being treated and the entry site for the laser insertion. The ultrasound tech and nurse use sterile technique to drape and prep the treatment area. Anesthetic tumescent solution is attached to a foot switch activated infusion pump to deliver the anesthetic along the treatment area. The insertion site is numbed with a local anesthetic. A short catheter provides access to the vein, and a guide wire is used to confirm entry with ultrasound. The guide wire is removed and the laser fiber is inserted. With the fiber in the vein, the catheter is withdrawn. The fiber is threaded up the vein with support from real-time ultrasound monitoring. The sapphire fiber option is used when a more flexible fiber is needed to negotiate veins with twists and turns. There is very little bleeding based on the small incision, and the patient is monitored for comfort and a pain-free experience. Once the laser is threaded and in place, the tumescence anesthesia solution is introduced and used to move anatomically sensitive structures, like nerves, away from the treated vein. The physician uses the ultrasound monitor during the injection of the tumescence all along the treatment route. The trailing fiber is placed into the auto pullback device, and the treatment starting point is marked using a piece of tape. The laser is then activated and the treatment setting is programmed on the console. The normal setting for treating a leg with venous insufficiency is 6 watts, 50 Hz. Here is an actual laser treatment ultrasound with an animation simulation demonstrating vein ablation. Notice the laser light emission micropulsing at the tip of the fiber. This exclusive CoolTouch clear tip technology reduces the risk of vein perforations and clot formations. Ultrasound monitoring continues as the laser travels back to the insertion point in the vein. Once the procedure is complete, a pressure dressing is placed over the insertion site. A compression stocking is then placed on the treated leg. Post-procedure instructions usually include walking to stimulate circulation and healing. Patients are scheduled to return for follow-up exam 1 week after the treatment. There is sometimes additional follow-up depending on the physician's treatment plan. The CoolTouch CTEV laser is the gold standard in treating venous insufficiency and varicose veins.
We've had such great success with the CoolTouch that we just don't want to get off a winning horse. We've just not seen any major complications with the laser. We've not had any nerve damage, no arterial damage, no skin damage, and no deep vein thrombosis in now over 3,000 cases. The recurrence of venous insufficiency is much greater after stripping than it is after using the CoolTouch, which is kind of surprising, but it's true. We do this procedure, we finish it, the patient gets up and walks for an hour and goes home.
With 99% efficacy rates, a 1320 wavelength laser targeting water, micropulsed energy producing clear tip technology, exclusive automatic pullback device, and different fiber options for treating difficult anatomy, the CoolTouch CTEV delivers a practice-enhancing environment. Patients suffering from chronic venous insufficiency truly understand the benefits.
This procedure changed my life. It gave me back my beautiful legs that I used to love, and it also let me wear my wardrobe again. I didn't have to wear cover-up or wear long pants or dresses that were down to my ankles or boots. I got to wear my flip-flops again, get in my bathing suit, and I was no longer embarrassed. Actually, it was amazing how much this procedure changed my life and gave me back one of my favorite assets.
The CoolTouch CTEV, producing positive results for both patients and physician practices.